Hi, this is Terry Kuti with DiepCFoundation. I have an important topic that I would like to bring up today with Drs. Ramon Garza and Dr. Minas Chrysopoulo from PRMA in San Antonio. When a woman faces a mastectomy, which I have, we have choices. We have choices to reconstruct our breast or not. So when a woman goes into a surgeon's office, what discussion should they have with their surgeon if they choose not to have reconstruction and they choose to go flat? Gentlemen, I'll let you take over.
Great question.
I think so too.
So when you ask a lady who wants to go flat, why, part of that discussion, it's important to realize what their expectations are. So going flat doesn't mean just breast removal. It means being flat and having a nice chest contour, not having significant contour defects if they can be avoided, not having issues with clothing because of tissue that's been left behind on the side of the chest. Some women, I've seen several women that already know ahead of time that they want to go flat and they want to have a very elaborate tattoo. Well, what they have left behind to tattoo is important, right? In terms of contour, in terms of overall chest contour. So there are ways in which a mastectomy is performed that will determine what that person is left with. So, I've seen a handful of quite unhappy patients. They weren't unhappy with their decision to not reconstruct. They were unhappy with what they were left with by going flat. It's, this isn't what I had in my mind. It's like, I'm not flat. I'm actually concave. There's this big defect in the middle. I can feel my chest bone, my ribs. There's excess tissue left behind everywhere else. It's not even at all. I'm not flat, I'm uneven, right? And so the choice to not reconstruct leads you down another pathway, but that in itself, going flat, warrants an in-depth conversation in terms of expectations so that you actually get what you expect to get and what you want to get. So I've actually done fat grafting on ladies who chose to go flat just to fix the contour so that they are truly flat and not concave. There are other things you can do for the tissue that's left behind on the side to fix the contour there over the outer part of the chest. So ironically, they're more plastic surgery techniques, but they're very, very helpful even in women who don't wish to have reconstruction.
Boy, that's good information. So, Dr. Garza, then in terms of that, really going flat is an aesthetic question too. And they could ask their breast surgeon, their plastic surgeon, tell me about the scarring. What kind of questions should they be asking about, prior to the mastectomy if they decide to go flat about the scarring?
Yeah, those are all great questions. With respect to the scar, in general, the scar is going to be a longitudinal line going horizontally across the chest. That's the typical scar pattern left when somebody goes flat. The biggest thing, I think, is patient selection. Not every patient has the same body habitus, body shape. Some patients have a wider chest, extra tissue, as Dr. Chrysopoulo said, on the sides. That is just part of their normal anatomy. When going flat, that tissue becomes more apparent. And a lot of times patients are unhappy who have gone flat initially because they feel that tissue is more prominent now. And it is relative to the tissue deficiency in the front. That area becomes more prominent, and it's something that they weren't expecting. So I think seeing patient pictures, talking to your general surgeon who's doing the cancer surgery, and also talking to a plastic surgeon, even if you don't want to have a reconstruction per se, and you want to choose to go flat, it's a discussion to have with a plastic surgeon who has experience seeing patients that have made that decision and may have had a similar body type to you, and to kind of help with the expectation aspect of things.
Yes. Which I would call the aesthetic outcome.
Absolutely. Mm-hmm.
Yeah. Wow. That's great information, because we know that breast reconstruction is a choice. Going flat is a choice. Great information, gentlemen. Thank you so much.
No problem.